Welcome back to Dr. Matt Parker's Holistic Perspectives channel. Today, let's talk about the conventional modern veterinarian and conventional modern veterinary clinic. So I've mentioned before that modern Western medicine is taught to us as if it's the only option and that it's superior to all other ideas, which of course isn't right. But one really good thing about modern Western medicine is the physical exam it teaches us. Modern Western medicine teaches a very, very thorough, mechanical, by the numbers physical exam, head to tail, tail to nose, whatever you want to call it. And by and large, almost all veterinarians are really, really good at this. So that's great. One of the things that happens in modern veterinary medicine, good or bad, is there are more and more diagnostic tools, newer and newer technology. We have x-rays and ultrasound and blood work and all these things that are great and provide us with wonderful information. But they're kind of teaching us to rely on those things and not rely as much on our physical exam all through several decades of school as these modern artificial intelligence, blood work and x-rays and all the other new stuff that I don't even know about. That kind of teaches us to rely on that and not trust our instincts, our intuitions, and our physical exam abilities. So that's a problem. But on the other hand, the modern Western medicine and physical exam is great for true emergencies, for trauma, for emergent hit by a car, bleeding, broken bones. It's great for that. Well, the reason that it's great at all that is because it's looking for something that's already happened. It's looking for a bone that's already been broken. It's looking for a cancer that's already grown. It's looking for a bleeding tumor or blood loss from a laceration that's already happening. It's looking for arthritis or a blown disc in the back that's already there. That's why it's so good at those things. Whereas the more holistic approach is to look for things that haven't broken yet, to find the imbalances that are still correctable. Modern medicine is good at fixing the things that have already happened, but it doesn't undo them. It just repairs them or puts them back. You've had blood loss, need a transfusion, it puts some blood back in there, and that's good. You have a broken bone, it mends the bone and it regrows. But it doesn't stop the fact that those things happened in the first place. Whereas your more holistic approach is going to look for imbalances. It's going to look for things like weak minerals or weak bodies or things that are making you more prone to breaking a leg. Or the most common thing, one of the most common things I see is blowing out a knee, an ACL tear. Well, there's signs and symptoms in the body and in all sorts of things that tell you those ligaments are getting weak and those dogs are likely to blow out a ligament. You don't find that on physical exam until the ligament's already blown out. Then you can surgically stabilize it or put it back together, but it's never as good as it was in the first place. We want to prevent those things from happening. And the physical exam, the modern Western physical exam, can only find things after they've already happened. So, there's great benefits to the modern approach in the physical exam, but it has nothing for finding chronic disease, chronic illness, or finding those imbalances that are going to lead to disease in the future. So, for example, 50 or 100 years ago, or in the 1950s, 70 years ago, your veterinarian or your medical doctor could poke on your abdomen and feel your glands and talk to you and ask questions and look at your skin color and look at your eye color. And even with the stethoscope listening to the heart of the animal or the person, they could hear all these little sounds that kind of today we're just trained to hear lub dub, is the heart beating fast or slow, and is it beating kind of normal. And years ago, without all these additional ultrasounds and blood work and x-ray tools, doctors had to listen to a lot more the fine details of the heart when they would listen. So there's things like that that we're missing and things like that that modern medicine doesn't get us. So those things aren't really taught anymore. And if they are taught, we don't have time to do all that. You've been to the vet and the doctor, you get a few minutes. There's not time for the vet or the doctor to be really thorough, even if they know these things or have learned these things. So it's like everything else in our modern world. We're being forced to abandon our learned hands-on skills and abandon our experience and our instinct and our intuition to instead rely on artificial technology. Okay, artificial technology is good for emergencies, but it's dumbing us down. It's taking away our skills to where we're not good at our physical exam anymore, even if we do have time for it. And what this leads to in a bigger picture is we become easier and easier to replace with something more like an AI robot or screen or FaceTime that will never ever understand the approach or consider the holistic approach to the things that are the underlying causes of disease. So that's what's happening at the modern vet clinic, and you just need to know that before you go in to know what to expect. That's the good and the bad of modern Western veterinary medicine. Thank you.